Hello, everyone. Good morning or good afternoon to all of you. I just want to here pick this up from my colleagues Helen and Isabel and reopen some of the issues that they already referred to from a slightly different, if not complementary lens. So I want us to think together on the connections between the current health crisis and the bigger challenge that is there awaiting, that of climate change. Climate change is already affecting the health and well-being of millions of people and non-human beings across the globe. In this way, what the question I want to pose here is, how can we think about the city and urban sustainability and justice beyond the scale of the city in light of the current pandemic? We're faced today with a paradox. We have been making our urban centers even bigger, busier, our food systems more industrial, our global movement and connectivity even faster and cheaper. And all this on the back of the assumption that our science is ever faster than pathogens and their emergence. Because or else, why would we keep producing these contextual conditions that favor their spread? Right? So as my colleague Salvador Puello recently argues, human society is putting itself in a race not just against pathogens, but also against itself. Health systems need to be running even more to keep in the same place. They need to be discovering new ways to confront the types of pathogens that emerge or reemerge because exactly of us continuing to exacerbate, continuing to produce the conditions that favor them. So what does that mean for cities and for urban justice? What kinds of opportunities have we provided for COVID-19 to emerge and to spread, to become a global pandemic? And how do they connect these opportunities back to climate change? How are these opportunities structured socially and geographically? Let's consider food systems, for example. We know that there are links between the emergence of new pathogens such as COVID-19, but also previous ones like SARS, Ebola, HIV, dengue fever. We know that there are connections between these emergencies and the pressures that we're placing on ecosystems and on animal populations. So we know that damaging biodiversity makes for simpler ecosystems, which are then more likely to transfer diseases, and that expanding our human activities into habitats where these diseases proliferate in animals are also increasing the chances that these diseases pass on to humans. This includes land use change and land grabs by and for the agribusiness. Last but not least, farming animals in industrial conditions and messing with our natural bodily ecologies and group ecologies. We have been making the conditions for what is very probable to happen, which is zoonosis. They always do happen, but we have structured our food systems in a way that these types of events can now very easily turn catastrophic. For more on this issue, I obviously recommend that you read the brilliant Rob Wallace, who has been researching on the issue for decades and who has written this book, Big Farms Make Big Flu. At the same time, and despite, or maybe exactly because of the way that the dominant global food system operates, many cities in Europe, in the midst of pandemic, have been experiencing problems in food availability because conventional food production is being challenged. As we read from the Urban Agricultural and Food Systems Initiative, this is because there's very limited diversification of value chains and supply channels in the city. In most cities, there's high or exclusive dependence on food imports, and connected to the above, there's limited linkages and cooperation with surrounding rural areas where production and processing of key food commodities take place. Because we have structured our food systems this way, the food-related problems that we are experiencing today in cities are driving very unjust impacts related to COVID-19. So, for example, people have to be working in really unhealthy conditions to sustain the level of food availability that the rest would enjoy. And we have, at the same time, placed stress on the well-being of those who lose access to basic food provision because of the measures that we are taking to control the pandemic. Let me give some examples. In Ireland, for example, we've been seeing a tremendous increase of COVID-19 in meat factories, meat plants, due to the fact that workers, in their majority immigrant workers, are not provided to the protective gear that they need and cannot follow distancing protocols in the conditions that they're working in. In the global south, there's a high number of people who are vulnerable and poor small-scale food retailers and consumers who depend on the day-to-day food-related or not economies, both formal and informal, and who now face or will be facing survival risks because of the measures taken to control COVID-19. At the same time, in cities today, we're seeing a great increase in demand for local and usually sustainably grown food, and in home vegetable growing and community gardens, and also in a lot of food solidarity initiatives. So what can we conclude from this? We need more local and diversified agroecological systems for food production that also respect and treat fairly the workers, the people that work within them. And until we transition to a more localized and sustainable system, we need to start supporting those who now work in the fields and in the food factories, a lot of which are marginalized and undocumented immigrants. We have to find the means to protect their health and to protect their rights. The second topic I wanted to touch on today, and Isabel and Helen also touched upon it, is the connections between air pollution, car use, emissions more generally, and climate change. So sadly, it took a pandemic to clean some of the air above our cities. And we're seeing headlines and news such as, smog stopped choking New Delhi, one of the most polluted cities in the world. Nitrogen dioxide pollution has dropped 30% in northeastern United States. In Rome, air pollution have plunged 49%, etc. In light of this realization, or maybe also clear visibilization of this connection between emissions, car use, and air quality, we have seen, and health, by the way, also there are studies showing that this has benefited the health of a lot of people who have been chronically exposed to air pollution. In light of this, in Barcelona, a number of collectives are pushing for a confinement of cars during and post the pandemic, meaning they're emphasizing that intense car use in cities and the major allocation of urban space for cars has been affecting the climate as much as it has been affecting our health. And it's creating multiple vulnerabilities, especially now in light of COVID-19. And so, as Isabel and Helen already discussed, it's important to understand and stress that coronavirus is a synergy of epidemics. It builds on already existing vulnerabilities and exacerbates them. And both COVID-19 as well as other pollution and environment-related diseases have clear underlying and unequally distributed social drivers. So the lesson that rises strong from this is that we need to prioritize open public spaces for pedestrians, for sustainable mobility solutions, for exercise, for access to urban natures, especially where they're mostly needed. And this will be benefiting the health of everybody, both now and in the long term. And it will also contribute to climate change mitigation. In this light, we also need to remember, of course, that any emission drop that might have short-term health benefits now will not necessarily last. Right? So if we go back to business as normal, so will emissions. As Rosine Comain says, an atmospheric chemist at Lamont Doherty Earth Observatory, the pandemic shows that we can reduce emissions, we can do it, but in the future, we're going to have to do it in a more controlled way so that not half the people lose their jobs. This connects to the last theme, perhaps also one that is encompassing the other two, and is the question of what kinds of economies do we need and how does this reflect on how we imagine the cities of tomorrow? We know that cities are very important for global economies. They generate more than half of global GDP. And we also know that most cities have internalized kind of imperative for constant growth, investment attraction, and expansion. And from the environmental and social sciences, we do know that urban metabolisms are connected to the extraction and circulation of materials and the production and dumping of waste in global scale. And so this all connects back to issues of environmental distraction, pollution, climate change, and eventually disease that cut through unequally and unjustly hinging on race, on gender, ethnicity, and class, among others. So what did I want to show with these pictures? We need to think what kind of cities do we imagine for the future, and what kind of urban sustainability do we imagine for our future when we think in these terms in social metabolisms connecting various scales. So I tend to agree with the growth proponents who call for a new roots economy, and they stress that while some sectors of the economy like fossil fuel production, military, and advertising have to be phased out, we need to foster others like healthcare, education, renewable energies, ecological agriculture. So it becomes clear that it's not enough to just increase access to green space or decrease the use of cars. Even if we try to do it in equitable ways, we need to think what aspects and sectors of the economy we want to recover and under what conditions should businesses operate, given the lessons emerging now stronger on the global and local interdependencies between places and between species. And so I think that cities need to shape policies that address and respond to these urgent matters, even if they escape the strictly defined urban sphere. For example, when we think about what kind of architecture do we want and for whom, what kind of business do we want to have in our cities, what kind of environmental ethics do we want this business to have, what is our yardstick of justice in the context of sustainability, both locally and globally? Do we want new LED certified buildings, which are mostly serving the elites? Or do we want to first look at what infrastructure already exists within and around cities and ensure that it is being used, repaired, and improved to host the kinds of sectors and activities that we consider most valuable and more vulnerable, perhaps, and more valuable for the majority of people and for the planet? For example, the city of Amsterdam, before the pandemic, had started discussing with Kate Raworth of the Oxford University Environmental Change Institute to start implementing a donut model for the city. And you can read all about it in The Guardian. This is a little bit what it looks like. But basically, this model provides a framework of how the goal of economic activity should be about meeting the core needs of everybody, but within the means of the planet, and for which justice and sustainability are considered in multiple scales. To conclude, having discussed all this, I think we need to work towards controlling epidemics today as much as we need to transform our societies and cities of tomorrow in order to avoid the reemergence of such types of health threats and their spread. So this goal, I think, is very much in line with climate change mitigation and planetary health, which a lot of cities do claim to be engaging and embracing. In this sense, we need to think that we need to put life and care in the center of our concerns and our actions, thinking about also those who perform most of the vital services in societies, like cleaners, the nurses, the drivers, the land workers, teachers. The fact that often these are the types of professions who are less appreciated and less paid, and also a lot of them are also very feminized professions. So to conclude, what kinds of alternatives can we propose as urban researchers, as practitioners, activists, organizations, in order to support and multiply the ideas and initiatives that do exist and that are based on solidarity and care, and which recognize and strengthen both social and ecological reproduction, and which are especially abundant in cities? I think this is a worthy question, and in light of all this, I think I will close. Thank you all for your attention and for listening.